Good morning. I'm Dr. Rachel Gonzalez, Chief Executive Officer at Madison Memorial.
I'm Jack Clark. I'm one of the hospitalists here at Madison Memorial, also the Medical Director and Chief of Staff. Rachel and I have both been fully vaccinated. We do have our mask for when we go back inside.
We thought it'd be helpful for the community to just hear the plain facts of what's going on at Madison Memorial. We've been having these conversations for the last 18 months, and the information is changing so rapidly that it's hard to keep up with it all. We've gone through all the motions I think everybody else has. Maybe some fear and uncertainty at the beginning, to feeling excited about the future and maybe COVID will go away, to, oh look, we've really got this, we know what we're doing, to heck, what's going on. There's been some hard moments, but there's been some beautiful moments of watching the staff and how they care for our patients and care for each other.
We didn't really know what this disease was or what it was going to do. The public got confused. They were getting medical information before it was fully developed. Preliminary trials that as physicians we're used to seeing things come out and then ideas change and we put away old ideas. The public isn't used to having that. Here's a new study, we have to change what we're doing. We went through a phase of about 2.5 to 3 weeks of zero COVID patients in our hospital. I think that was kind of early June. With this surge that we're seeing right now, patients do seem to be getting sicker faster. The ones who get sick respond about as well to the same medicines, but part of the problem is some of them are coming in later. It's harder to treat if someone comes in later. First phase, when patients would come in, they were very grateful for what we were doing. Now we have occasionally people coming in saying, well, why aren't you using this medicine? Having read a bunch of studies and talked to experts with Intermountain Medical Center, the University of Utah, about protocols, about which medicines were scientific in our approach, the hospital plan set up in a 4-phase approach and how we're going to treat patients, what things we're going to shut down. Before June, we only got to phase 2. Just last week, we went into phase 3, where we were shutting down our sleep lab. It did affect our surgical department. Patients having surgery were having to stay in the same day surgery overnight.
Madison is certainly not the only hospital seeing an increase in COVID patients and overall patients, quite frankly. Every department in every hospital seems to be busier. We hope people are not putting off healthcare, accessing healthcare when they need to at the appropriate levels. The increase in volume of all hospitals, including in our region, impacts our ability to transfer patients that should be transferred.
Our emergency department is getting busier, seeing more patients than they've ever seen. Sometimes we're having to have patients stay in the ER longer. We had a patient with more things going on than we can take care of at our hospital. The closest one was in Provo, Utah. It's amazing how far we're having to look. Yesterday we had at least 5 hospitals calling us wanting to transfer patients. Unfortunately, we were at the point that our surgery patients were staying downstairs instead of coming up to our medical floors. In northern Idaho, in a 140-bed hospital, 110 of those beds were full of COVID patients.
We need all of the system working well and working well together. It isn't just about an inconvenience of going further for your health care. Healthcare is very timely. Everybody in healthcare wants to do the most they can at that point of care. If you don't have access to all of that, it hurts everybody's hearts a little bit. Be concerned and cautious of the strain on the resources in healthcare right now. Like the rest of the country, we have some staffing shortages. If you have a desire for healthcare, touch your local hospital and see what you can do to help them. This is a time of coming together.
There's jobs all over in healthcare. I'd recommend it. Probably seeing between 75 to 80 patients. I've only counted 4 patients who've been fully vaccinated. Very similar to the national average, about 1 out of 25 is actually fully vaccinated. It's sad to see that 24 of those patients didn't need to be in the hospital. I have talked to several of the OBGYNs. They're seeing changes in the placenta. The babies are having small birth weight, very similar to someone who smokes. It's having adverse outcomes for moms who get COVID. The OBGYNs I have talked to are all in line with the CDC recommendations that pregnant moms get the vaccine. Talk to your provider. The problems of the disease are worse than the problems of the vaccines. I have had 0 admissions for patients with vaccine complications. But what I have seen is a bad COVID disease. We're not admitting very many patients who've been vaccinated. Those that we have admitted who've been vaccinated have gotten better much quicker. It's been impressive in terms of how much better the patients do if they do have to be admitted if they've been vaccinated. The COVID vaccine was very different technology. It's an mRNA vaccine that only codes for one of the 5 proteins that the COVID virus makes. You cannot get COVID from the COVID vaccine. For the first 3 days, your viral titers go up the same, whether you're vaccinated or unvaccinated. At day 4, the vaccinated person, their viral titers start dropping. The unvaccinated person, viral titers keep skyrocketing. It's usually 7 to 10 days when we see patients coming into the hospital. Something made influenza not flare up last year. I think I only admitted one patient with influenza. It used to be 3 to 4 times a week. Some of the experts worry that when a disease has an off year, that the next year it may come back twice as strong. I'd highly recommend that people get their influenza vaccine and their COVID vaccine. I'm fully vaccinated. I could still get the Delta variant. If I cough and sneeze on someone who's a cancer patient, an immunodeficiency where they can't take the vaccine, that person could get sick. Until we can get out of this phase of the pandemic, please wear your mask when you're in public, when you can't social distance. It could be life-saving to help each other. A year ago, I was saying, get this so you don't give it to your grandparents. It's younger and younger patients. I even had a 22-year-old in the hospital. To me, that's even more reason to try and get children vaccinated, because now it's their parents, it's not their grandparents that could end up sick. I've been impressed with the quality of the work by people here. Seeing managers come out of their offices and run CBCs and do labs. 2 months ago, we would admit any of these patients. Now they're having to try and make decisions of which patient gets admitted. Our staff has been doing a great job.
Thank you to everyone that has been following the measures, trying to help us. Certainly thank you to all of our staff.
The Medical Executive Committee has voted October to be Healthcare Worker Appreciation Month for Madison Memorial Hospital. We just appreciate what everyone is doing to help us treat patients the way we want to treat them.
I wish you could just see what it looks like. Staff giving through this pandemic, and we're proud of them. It's a feel-good moment. It's why we're here.